Okay, welcome everyone to the Thursday, November 2nd, 2021 Board of Education meeting for November. We will begin with an invocation from the Union County Sheriff Office.
Heavenly Father, we thank you for the blessing of this day. And we thank you, Father, for the privilege of prayer. Lord, we thank you for each one that is gathered here this evening. And we ask you tonight, Father, to remind us of, as board members and, Lord, as teachers and parents and citizens of our responsibility, Lord, of this wonderful county that you've allowed us all to be born in and be a part of. And Lord, I just pray that you would help us to remember that our responsibility is to our children, but our accountability is to you. You remind us in your word that our children are a heritage to us, not only to carry on our names, but to carry on the lives that we live before them. So, Lord, as we remember this tonight, Lord, help us all to unite together, understanding, Father, that the decisions we make are going to carry them through their adulthood. And so, Lord, we thank you, Father, that this great nation we live in has been blessed because it's one nation under God. And so, Lord, help us to keep carrying on our forefathers, Lord, what they envisioned. And, Lord, may these decisions tonight help keep moving forward that vision. And, Lord, we thank you for all that you do for us. And we ask you to bless everything that goes on from this point forward. In Jesus' name, amen.
Thank you very much. If everyone would please stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That brings us to approval of the agenda.
So moved.
Second.
All those in favor say aye.
Aye.
Aye. We will now have the John H. Crowder Service Award. I'll turn it over to Mrs. Heintel.
Oops, it's already on. Good evening. The late John H. Crowder spent more than 30 years serving the children of Union County. As a living tribute to him and his legacy, the Union County Board of Education awards the John H. Crowder Service Award every month to an outstanding high school student who is making a difference in their school and community. Students who receive this award are not only academically successful, but also have an established history of community service. Tonight, we award the John H. Crowder Service Award for November to a Piedmont High School senior who is a shining example of dedicated leadership and volunteerism. Landry Bigham is an excellent student and a wonderful role model for others. She is ranked at the top of her class at Piedmont High School. Landry is a member of the National Honor Society and the Beta Club, in which membership is determined by GPA and commitment to community service. Through these two clubs, she has been able to give her time to an organization called Heart for Monroe and Common Heart Food Pantry. At Heart for Monroe, a nonprofit organization that exists to address homelessness and build relationships in our community, Landry helps with the class ministry. She spends her time there sorting clothes, assisting shoppers, and managing the checkout area. Landry is also an integral part of the Piedmont High School family through her involvement in activities on campus and through sports. These activities showcase her true zeal for wanting to help those around her. She is also a part of school government, where members are always trying to engage the student body and make decisions that affect all students. Last year, when students were struggling with online learning, Landry stepped up and did peer-to-peer tutoring. She would spend her mornings before school meeting with students to help them with their schoolwork. Also, through student government, she has served in 2 leadership positions, first as the treasurer, and this year she was elected by her peers as the chief operating officer. In this position, she works with the Piedmont High School's bookkeeper to order supplies and distribute them. Landry has participated in homecoming events, Start with Hello Week and the Sandy Hook Promise Program, which teaches empathy and empowers students to end social isolation. Those events, along with writing inspirational quotes on the sidewalk and Smile Day, where students received a treat for finding smiles around the campus and sent thoughtful thoughts to others, were all organized by the student government. Landry is well liked by her fellow students for her enthusiasm for serving others, which can also be seen through her involvement with the tennis and swim teams. Landry represents many of the qualities that embody a Piedmont Panther. Board members, please join me in congratulating Landry Bigham as the November 2021 recipient of the John H. Crowder Service Award. Congratulations, that's awesome. Here is your thing, and they're going to take pictures of you. Congratulations, thank you very much.
Congratulations, Mom and Dad. Good job. At every regular meeting of the board, up to 60 minutes have been allotted for public comments. As there continues to be a waiting list for public comments, the period will be expanded to the full 60 minutes. Given the number of speakers signing up each month, beginning the month of December, the board may exercise the following provision from NCGS 115C-51 and Board Policy 1-12, public participation at board meetings. This states the board may provide for the designation of spokespersons for a group of persons supporting or opposing the same position. As referenced above, the group spokesperson that is chosen will be allotted 5 minutes. The board may provide for the selection of delegates from groups of persons supporting or opposing the same positions when the number of persons wishing to attend the hearing exceeds the capacity of the meeting room. The board will not respond to public comments. However, a member may ask that the chair obtain clarification. Residents, parents, students, and employees of the district will receive priority on the list of speakers. If a speaker is not present when his or her name is called, the opportunity to speak will be considered waived. Only persons signed up may speak. Speakers may not give their time to another person or have someone speak on their behalf. Individuals may address the board for a maximum of 3 minutes. Any person who is appointed representative for a group may address the board for 5 minutes. A representative must state his or her affiliation prior to speaking or will be assigned the 3-minute period. The board will not hear in open session complaints about the performance of school personnel, personnel issues, or confidential student issues. Should a speaker wish to seek information or share items that may not be shared during public comments, our staff are available to address your concerns or provide information. Dr. Brad Breedlove, Chief Academic Officer, Dr. Bashan Harris, Assistant Superintendent for Human Resources, and Jared McCraw, Assistant Superintendent of Student Services, are here to assist. Also, Policy 1-12 states, in the interest of maintaining civility and decorum, speakers are encouraged to refrain from personal attacks and insults directed at board members, the board or individual members, staff, or members of the general public. Our first speaker tonight will be Kelly Cartarelli.
Good evening. My name is Kelly Cartarelli, and my daughter is a 6th grader in UCPS. I came here last month asking that you would try masks for 30 days. I'm not asking that this time because, let's be real, I know it won't happen. The vote you have to make every month is nothing more than a formality where your votes have been decided long before any of us have arrived here tonight. Now that we are coming out of the most recent COVID surge, numbers are going down, which is to be expected. That's great news. Nobody in their right mind wants to see cases increasing. However, I've seen some people patting themselves on the back for staying the course and for the decrease in numbers, despite doing nothing to really contribute to that decline. Thousands of students are still quarantining every single week, and our country still has 70,000 cases per day, so unfortunately, we aren't quite at the finish line yet. We will have another surge, more students will get sick, and many more will miss school because they were exposed. It's kind of funny that a district that is not officially offering a virtual option this year has so many students learning in what's basically a virtual environment, but worse. Most children in quarantine have to piece together a virtual education through what's posted on Canvas. Just a couple weeks ago, all of my daughter's core teachers were either out with COVID or in quarantine, so she had substitutes. Although she was physically in school that day, she might as well have been home. She was sitting there in school in a classroom, but doing all her work off Canvas with zero actual instruction. And this isn't even the worst of it. Some schools have such a shortage of substitutes that students have to sit in the cafeteria for hours at a time. How are any of these very avoidable scenarios acceptable? How is this a quality education? While you may choose to take credit for the good, you also need to take responsibility for the bad, for the medically fragile children and families forced to homeschool, for over 1,000 students and teachers who have been infected with COVID since school started, and for the thousands and thousands of learning and teaching hours lost this year, all because of the choices you made. You need to own all of that too, not just the good. Thank you.
Our next speaker is Andrea Coleman.
I stand here tonight grateful and relieved that my children will be vaccinated this Saturday. I'm so thankful to the scientists and medical community who've worked tirelessly for this huge step forward in fighting the pandemic. Despite this positive development for the health of our country and county, I'm still left with a feeling of disregard and, I'll admit, bitterness over the inaction of this board. It quite frankly didn't have to be this way. From your inept and negligent handling of contact tracing that is still an ongoing disaster, to your outright denial of science as you continually place the value of parental choice above a child's right to health and safety, this board has taken every opportunity to prove that you have absolutely no interest in protecting children. My children have not only had their physical health threatened daily by your lack of action, but their mental well-being has also been hugely affected. They don't care about wearing a mask, but they do care about seeing their friends, teachers, and other members of their school family get pulled to quarantine, get sick, or heaven forbid, die. Your own core values, as stated on the BOE website, focus on community responsibility and citizenship. They state, health, ethnic, safety, and environmental considerations should be taken into account in all the operations of the school system. If taking every precaution possible, including masking and timely contact tracing, isn't included in the aforementioned core value, what I ask is, you've been elected not for your political opinions, but for the task of keeping our schools a healthy and safe environment so our children can learn to the best of their ability. A kindergartner on their second 2-week quarantine is not doing their best learning while trying to navigate Canvas on their own. Our quarantine numbers remain in the thousands. Teachers are leaving the profession in record numbers, and instructional time lost is at an all-time high, as some kids are sitting in cafeterias with little more than a Chromebook to serve as a babysitter due to staffing shortages. I know this board loves to take credit for last year's admirable test scores. How do you think those test scores will be this coming year with so many missed learning opportunities? All it would take to protect these kids, their teachers, and by extension, the quality of their education is a mask mandate. Even with child vaccinations on the horizon, We know a significant percentage of this county's population will choose not to protect their children through vaccination. Until the positivity rate drops to under 5%, an indoor mask mandate should be put in place. This board suffers from an excessive preoccupation with your own self-sense of importance. This prideful and belligerent act of refusing to do the right thing has led the common sense parents of Union County to lose all faith in your decision-making ability. If your constituents can't trust you to do the right thing with this, how can we trust you with our children's education?
Thank you. Our next speaker is Erin Ewert.
Good evening. Thank you for allowing me to speak. My name is Erin Ewer, and both my children attend Union County schools. I know all of you are looking at infection rate graphs and believe COVID is coming under control, but if you look over the past year, you will see repeated surge cycles. Without effective safeguards, we will see another surge of infections and death after the holiday season when children return to the classroom. On top of this, we still have over 1,000 students unnecessarily missing school due to quarantines each week. It's inexcusable that the Board of Education has failed to align school practices in a consistent way with the Strong Schools North Carolina Public Health Toolkit on masking, teacher vaccination, and testing and quarantine. Our families and communities are being put at risk by a patchwork of practices. For example, parental notification of exposure sometimes comes from the school, sometimes from the county, and sometimes not at all. Quarantine periods are inconsistent. Requirements for teacher vaccination or regular COVID testing are ignored. The Board of Education declined resources for free COVID testing. The dashboard is inaccurate, and all of you have been emailed several times about the inconsistencies in schools reporting positive cases and the weekly dashboard that comes out on Friday. Poorly managed health risk mitigation has broad long-term consequences. Our children's education is being disrupted. Teaching staff numbers have been substantially reduced to infection, quarantine, and reasonable fear of COVID exposure at school. Too many classes are taught by substitutes or assistant teachers, and for too long. Now with the shortage of substitutes, too many students get moved out of their classrooms into a noisy auditorium or cafeteria with other classes and with little or no instruction. Some students are added to another teacher's classroom where something different is being taught. IEP services are reduced or missing altogether. I've heard more teachers will be putting in the resignations over the holidays. Acting like none of this is happening and denying the truth does not make it go away. It just makes you look out of touch and indifferent to the needs of the teachers and the staff in our district. As a Union County voter, I've lost confidence in the school board's commitment to keeping our children safe and ensuring their education is uninterrupted. I've lost faith that you even care about our education system at all. I urge you to reduce infections and school disruptions by simply making masks mandatory. Masks are proven effective at reducing infections and deaths, and it will keep our children in school. Our children are North Carolina's most precious asset. Our teachers make Union County Public Schools the amazing school system it is. I urge you to put them above your political agendas. Thank you.
Gera Rodden.
Good evening. For 2 years, my husband and I have done everything we can to keep our son safe from COVID. He has asthma and recurrent croup, which means that when he gets sick, there's a good chance we're going to the emergency room with a child that can't breathe. My son is an otherwise healthy, smart, kind, and hilarious 5-year-old, and he is worthy of receiving an education in a safe environment, but that's not what you're providing him. How is that acceptable? Every day I have to assume that my child has been exposed to COVID because you refuse to mandate masks and have made contact tracing so complicated that it is no longer effective. Every day I worry that my child will spread COVID to his grandmother, a 2-time cancer survivor with 1 kidney. How is that acceptable? At my job, it is required that I be vaccinated, wear a mask, and socially distance in the office. I have the privilege of going to work every day and feeling safe. Why is my child being denied that same privilege? How is that acceptable? Every month you ask if any of our children are currently in the hospital. And if the answer is no, you pat yourselves on the back for a job well done. That seems like such a ghoulish question. Is that really the standard to which you are holding yourselves? We have children with long COVID in this district, children who have lost their toenails, who live in pain, children who have had to take breaks while trick-or-treating to catch their breath. How is that acceptable? What we are asking for is the bare minimum of protections for our children, the great sacrifice of wearing a mask. What you call tyranny and fascism, we call doing the very least to protect the least among us. Your indifference to the suffering of the families of Union County has been noted. And as a lifelong Republican, I'm ashamed of how you've acted. Being a Republican means putting God, family, and community first. It means protecting the vulnerable and caring for our neighbors. This isn't it, folks. This isn't it. Tonight, I implore you to mandate masks in our schools until our children have the chance to be fully vaccinated. And if you are unwilling to do so, at least have the dignity and respect to explain to us why. Why are you so unwilling to mandate masks and help protect the vulnerable? Why do you believe it is acceptable for you to ignore all advice from medical and academic professionals and take away our parental rights to a safe education for our children? What research can you point to that says that my son is safe from COVID while spending 7 hours a day in a closed room with 35 other unvaccinated and mostly unmasked 5-year-olds? Because I've looked for that research and it doesn't exist. So when you vote no, which I'm sure most of you will, at least have the guts to look right into the cameras, right into my face, and explain to me why my son's life is worth less than the discomfort of wearing a mask. Thank you.
Alicia Preston.
I'm here tonight to be a voice for our educators who feel they've been silenced. I've taken words from some teachers in our county, and I'm bringing them to you to express the reality our beloved teachers are experiencing currently. Their concerns have been ignored, danced around, and not taken seriously. There is fear of repercussions from speaking out, mixed with the knowledge that every plea and warning from the past year and a half taken to the district has been ignored. They are in crisis mode, and this isn't sustainable. Some words were, there is a lack of teacher and staff support right now. It's fly by the seat of your pants, and every school follows their own rules when it comes to COVID and safety. We've had 22 staff members out in one day with less than 4 subs for about 1,000 kids. That's not safe by any means. We are told over and over again that the county is working on it, but we never get an answer. I hear incidents of fights, of extreme bullying, etc., and there are no adults present outside of the teacher to intervene in physical altercations. That's not safe for the students or the staff. More words. We cover a class almost every day for 35 minutes during our planning, which means we have no time to plan our own classes. We are short-staffed so much that when we call for emergency assistance in our classroom, it takes more than 10 minutes, if they ever even show up, for someone to help us. So we basically teach 3 classes and cover a class, all while eating lunch with our students. When it comes to the constant exclusion of students due to exposures, the same lack of support is apparent. More quote. Nothing is offered differently when they are at home quarantined. There is no clear direction on that. Kids come and go nonstop, and we never even know if they're actually supposed to be here. Some get logged into Power School, and some don't. I have not seen a single student get tracked. Kids need to be in school, period. In many of our schools in Union County, children don't have the luxury of staying home with mom while completing emailed assignments. Many children do not have an adult at home, and no one is keeping tabs on them when they're not in school. I hear repeatedly from people that schools are not parents or medical facilities, but for many kids, they are. And when a teacher doesn't even know where a child is, that's a problem. I asked a few teachers about how they feel bringing these concerns up to administration. All of them have said that they have expressed concerns and received a blanket general statement back and no assistance. One teacher has taught for 13 years, and this has always been the case. Surveys are once a year, and the teachers report that instead of addressing the issues, they are usually dumped on principals to resolve, when often these issues are beyond what a principal can control. I will conclude with a quote from one of our beloved middle school teachers. I would love to ask if they have ever been in a UCPS school long enough to be cussed at, threatened, and disrespected all before 9 a.m., and then want to come back the next day and do it all over again. Thank you.
Erin Driver.
Thank you for allowing me the opportunity to speak. I'm a Charlotte native. I'm married a Union County native, and I've lived here the majority of my adult life. I have 2 children in UCPS. We've been fortunate enough to experience some of the best teachers, support staff, and administrators from their schools. Ethics, empathy, morality, compassion, basic human decency, basic life skills, which it seems many of us have forgotten about. As an elected official, I said it earlier and I'll say it again, we are held to a higher standard, Mrs. Merrill said. The board holds employees accountable to a certain standard, and we would expect that as well. I will say any form of harassment or communicating threats from online, cyber stalking, any of that is completely unacceptable. I also feel like the selection of how the community can interact sometimes on social media through emails, through copy and paste replies through emails, or some just ignoring emails completely, is not respectful. We just want to hear back. We just want to know that we are being heard. Are you really listening to us? Are you really watching us? It doesn't seem like it. It is great to see that COVID numbers are going down, but imagine how many kids we could have kept in schools with a mask and a virtual option. How are the cooler months going to fare with all of this going on? I take issues with the discrepancies on the dashboard. The emails parents receive and the dashboard are just not lining up. You expect parents to trust that, but yet we have several of you who do not trust the science. It's no longer about the science. We're long past that. It's about politics. I feel there is a greater liability of us losing our liberty. Gary Side said back in June. Who is at risk of losing their liberty here? Me, you, our teachers, our students, moms, who is it? It doesn't become a parent's choice anymore. It's become a 5-year-old's choice. It's become a 3-year-old's choice. It's become an 8-year-old's choice when they're in school. There is no oversight allowed in the classrooms for that. If my children missed as many days as these kids have missed during quarantines, we would be in truancy court, right? This is Union County Public Schools. The fake outrage at Board of Education meetings are all stepping stones to the theocratic, authoritarian privatization of public schools. Remember always that the board members' first and greatest concern must be the educational welfare of the students attending the public school, the students in the public school. Thank you for your time.
Norm Perrault, and I apologize if I botched that.
Good evening. My name is Dr. Norm Perrault. I'm a resident of Indian Trail. I have 3 daughters enrolled in a middle school in the district. First, let me say that I am not a medical doctor, so I'm not qualified to speak about the safety and efficacy of COVID vaccines or the benefit of masks in the classroom. I do not have a PhD in child development, so I'm not qualified to speak to any impact about mandating masks, social distancing, or vaccines. For these topics, we should, of course, all defer to the experts. My doctoral degree is in a field known as industrial organizational psychology. This field involves the application of science-based philosophies and practices to the employees and leaders in a work context. Over the past 23 years, I've educated and coached thousands of leaders on the unconscious biases that often come into play when making important business decisions. Unconscious biases are traps that we as human beings often fall into that cloud our judgment and can lead us to make incorrect decisions. After watching last month's board meeting, I thought my expertise might be useful here. I could talk to you about affinity bias, the tendency to favor individuals who are similar to yourselves. I could also talk about halo bias, such as the idea that if a federal agency has poor policies at the southern border, a completely different federal agency must have poor policies overall. But by far, the form of bias that I'm most concerned about here in these meetings is confirmation bias. Confirmation bias is a tendency to search for, interpret, favor, and recall information in a way that confirms or supports your existing beliefs. Last month, parent after parent came up to this podium to share their experiences with inaccurate dashboards and slow contact tracing. But I feel that many of you had an existing belief that the process was actually quite fast and reliable. As you questioned Jared McCraw, you seemed focused on discrediting the experience of parents and affirming that the dashboards and contact tracing were operating like a well-oiled machine. You heard both from public comments and through emails that many staff members don't feel safe in their work environment and that teachers were fearful of speaking out against district policies. And again, in the board meeting, you fished for evidence to support your belief that the staff is happy, content, and comfortable expressing contrary opinions. You failed to challenge Dr. Houlihan when he shared that the district's quote unquote open door policy also requires staff to follow the chain of command. Finally, when parents express concern over the lack of education occurring when students are quarantined, you lobbed softball questions to Dr. Houlihan, allowing him to discount those feelings and affirm your existing beliefs, even after the superintendent admitted that we have no Tier 3 option for educating quarantined students. Fighting confirmation bias is difficult. It requires you to set aside your personal beliefs and theories, much like a crime scene investigator does. You need to play devil's advocate and actually seek to disconfirm your existing beliefs, to confirm that they are wrong. Only then can you separate your own personal beliefs from reality.
Brian Helms.
Hey, good evening. My name is Brian Helms. First of all, I'd like to say I'm not here to insult the board or psychoanalyze you guys. I would actually like to thank this board for your efforts to keep UCPS mask optional. Currently, UCPS, with their mask optional policy, has substantially lower case rates, 4.593 in the last 14 days per 1,000 people than many other mask required districts such as Gaston, Anson, Cleveland, Rutherford, just to name a few. Lately, the discussion in public comments is largely centered around masks, but we have other issues in UCPS that need to be addressed. On June 28th, I submitted a list of 22 book titles to UCPS staff and requested info regarding the availability of these in UCPS libraries. I received a response on October 28th. Of the 22 titles, 21 are present in at least one UCPS library. Many are present in multiple middle school libraries like Sun Valley, Weddington, Parkwood, and are currently checked out by students. Included in this list are such controversial titles such as Monday's Not Coming by Tiffany Jackson. You may remember this title. Passages of this book were read at a Loudoun County, Virginia Board of Education meeting by parents. This title contains sexually explicit content and includes sexual encounters in the classroom, as well as details how a female character is beaten and thrown into a closet. Many review sites list this as age appropriate for ages 16 and up, yet this title is available in Sun Valley Middle School. To be clear, I don't agree with censorship. I think it sets a bad precedent. We all remember the May meeting. However, we are dealing with the question of what is appropriate for children. Appropriateness and censorship are two different things. The titles on this list include sexually explicit content, rape, sexual assault, transsexual relationships, anti-white racism, homosexuality, hatred of police officers, drug abuse, addiction, CRT, and more. These books and other resources are teaching our kids that it's okay and normal. Is that what we want for our children? If adults want to read these books and spend their own money to buy them, that's their choice. But giving these children access to this in public funded schools is inexcusable. I won't stand for this in our schools. This is how CRT, SEL, and DEI have been snuck into the minds of children. It's subtle, it's sneaky, it's meant to not draw attention, but it's got to stop. For years, I think we've all gotten comfortable. We have blindly trusted that books and concepts like these would not permeate our schools. We were wrong. And now we have to dismantle this agenda, brick by brick, piece by piece. In July, I recommended to the BOE that we form a parental advisory committee to provide oversight on media resources. I think it's time that we implement that. One of the things that truly sets UCPS apart is the collaboration between parents, teachers, and board members. This collaboration is needed now more than ever. I truly hope that you guys consider this request. Thank you.
Amanda Walters will be speaking for Sisters for Liberty as a co-founder, and she will get 5 minutes.
Good evening, and thank you for the opportunity to speak before you. I also want to thank you for continuing to allow parents the right to make choices that are best for their children. My name is Amanda Walters. I am a co-founder of Sisters for Liberty. I live in Indian Trail area with my husband and 2 kids. While we currently homeschool, however, I stand with these parents month after month because these kids are our future leaders. And if my family decides that homeschooling is no longer an option for us, we need to make sure that the school system they would attend is strong. There's a plethora of topics that I could touch on this evening, but I felt a tug to talk about vaccines and vaccine clinics. No, I do not have a medical degree, but I can read and I know how to think critically. There will come a time when this board must make some difficult decisions on vaccines, and I know it will be a decision that is not taken lightly. I pray that the words I speak this evening will help you make your decision when that time comes. The word vaccine triggers a lot of emotion in people these days. You are no longer allowed to ask questions about the science behind the vaccine. You are labeled either pro-vax or anti-vax based upon whether you've gotten your COVID shot. You are also supposed to accept what is said by chosen doctors and scientists because the science is settled. A little excerpt that my 11 and 13-year-old pointed out while we were reading from their science book. Science cannot prove anything. It can provide evidence that a certain idea is true, but it cannot prove the idea. Science is also not 100% settled. History of science has shown us that scientific theories and laws can be overthrown because of new information and ideas. Even a single counterexample can demonstrate a theory to be incorrect. The definition of a vaccine has changed 3 times over the last 6 years. Pre-2015, it was an injection of a killed or weakened infectious organism in order to prevent the disease. In 2015, the definition changed to the act of introducing a product into the body to produce immunity to a specific disease. In 2021, the definition was changed again to the act of introducing a product into the body to produce protection from a specific disease. With those definitions in mind, think of the current vaccinations that are required to attend school: polio, MMR, varicella, etc. They all fall into that first definition category. You were injected with a killed or weakened organism that made your body build those antibodies so that you wouldn't catch the disease you were vaccinated for. Fast forward to today's definition of vaccination and the COVID vaccine. If you got the vaccine, you were infected with a spike protein or injected with a spike protein that they said would stay in the arm and build your immunity to keep you from getting sick. Both of those were lies. The spike protein technology is new and is found built up in all organs of the body. Do we know what damage that spike protein is going to do long term? No. The second lie is that this vaccine will prevent you from catching COVID. They have had to backtrack that statement as well. It seems you are not truly building antibodies if you get the vaccine because it doesn't have any killed or weakened SARS-CoV-2 organisms in them. It may be helping to reduce the symptoms, but you're going to have to get a booster shot every 6 months. If it isn't preventing anything, it's not truly a vaccine, and the fact that the CDC has had to change their definition yet again to cover themselves proves that. I am sure that you've also seen that Union Academy is teaming up with the Vax Clinic to hold a vaccination clinic at their school next Friday. I pray that this board does not allow that to happen in our schools. It is the parents' right and duty to determine their medical choices, and it's the school's job to educate our children. Just because something has been approved does not mean that we know all the long-term effects. Per the NIH's clinical studies website, the studies last until 2023 or beginning of 2024. Not knowing the long-term effects, coupled with the numbers from the CDC's website as of yesterday that state 549 children from the ages of 5 to 17 have passed away in the last 20 months from COVID, are large factors in what hold parents back. They have questions and reservations, and rightfully so. Schools are to have the students' best interests at heart, and that means leaving medical decisions to parents who know their child best. When schools get involved with healthcare, it becomes a very slippery slope. Medical procedures should be left to doctors' offices and hospitals. Everyone talks about how schools are supposed to be a safe place for kids to learn. But when you start allowing medical procedures to be done in schools, you remove that safety net. My prayer is that you do not mandate the COVID vaccine for staff or students. And if it is mandated by the state, that the exemptions that are allowed currently are still allowed without repercussions. I also pray that you keep vaccination clinics out of our schools. Let the parents decide if they want to get the vaccination. Convenience does not mean it's the right thing to do. Thank you.
Our next speaker is Laura Casey with Charlotte Area Liberal Moms, and you will get 5 minutes.
I am frustrated.
I'm frustrated by some of the actions and inactions of this board. I'm frustrated on behalf of students, teachers, nursing staff, and administrators of our district. I'm frustrated that we meet monthly and must discuss masking and safety, and yet so many other issues get lost in the desire to push a singular agenda of optional masking. And though I know we won't share all of the same concerns, I do know that my frustration is palpable and is shared by everyone in this room. It is time to turn frustration into action. Charlotte Area Liberal Moms makes a point of saying that we are not merely a group to discuss things, we are a group of action, and today we would like to welcome you in and give you the opportunity to be a group of action and change as well. And to this point, we are presenting 3 critical items that we would like to see on an agenda, be they at a monthly school board meeting or within the relevant committees for first review. The time to act is now. First and foremost, although we may be disheartened, to put it mildly, at the positions of board members on masking and quarantine, we recognize that we cannot rewrite history, nor can we undo the decisions that have been made. In all things, we must reach a point where we stop relitigating a topic and decide to move forward to address impacts and resolve issues. To march for a better future together from where we are with a full understanding of the history that got us there. We want the board to directly address the inequities and shortcomings resulting from your handling of the pandemic safety measures. We have students that have been approved for homebound services that have yet to receive them, and the first quarter of the school year is already over. It is unacceptable. Fix it. We have students that have had physician recommended accommodations that are denied and were forced to withdraw from the public schools. How has this impacted their education, our community, and our district? Find out. We have had students missing countless days of instructional time due to unnecessary quarantine, isolation, and exclusion, which would have been avoided had we simply mandated masks. Own that. My son has missed 14 days, and I know other children that have missed 28 or more. And if a parent were to have their child absent from school this much, it would be truancy or a criminal charge of aiding the delinquency of a minor. Why should that be any different when the responsibility is yours? And how will you resolve the educational inequities that this has created? We want a specific initiative to address any potential learning loss or negative educational impacts for the students with a clear plan. And where we are able, we should avail ourselves of federal funds at no expense to taxpayers. If necessary, an initiative should include an optional survey to all parents and teachers in the district explaining that while it is optional, any responses will be used to determine a full picture of impact. Second, we want to recognize and praise the teachers and administrators that made UCPS the #1 school district for test scores in the state. However, we also want to ensure we acknowledge that the success was not evenly distributed. Underperforming schools had less than 80% of the student body take exams, and where they did, we showed more than a 30% average decrease in testing scores, far over the average 11% at the highest performing schools. If we look at schools by a percentage of free lunch or by the racial makeup of the student body, the picture becomes even more discouraging. We are leaving Title I schools and our Black and Hispanic students behind. It is a true testament to the strength, resilience, and power in our community that UCPS remains one of the most diverse school districts by almost any measure of diversity. The racial makeup of our school district is one of the most representational. The breadth of income levels represented by families in our district spans from one end to another. The sheer magnitude of religions, ethnicities, and communities represented in our schools is a beautiful thing, which even as I say it in sorrow, as we have yet again held another school board meeting on a high holy day, first Rosh Hashanah and now Diwali. The challenge of meeting all the needs of various populations in our schools is unique, and yet you have not risen to this challenge. We are asking for a new administrative position to bring in a professional whose sole job and expertise it is to look at the various populations in our district, determine the needs therein, and address strategies and improvements to ensure that all students are capable of success within Union County Public Schools and that no one is left behind. This should be filled by somebody that has a demonstrated success in this area, as well as an education background specific to diversity within the educational environment, so that they are best able to advise the board. If necessary, a committee formed of parent, student, and teacher representation from each cluster should be formed to advise on the necessary qualifications and skills of this role. Thirdly, our teachers work tirelessly to ensure they are providing adequate supplemental materials, but without continuous support, this has been managed on a case-by-case basis. Moreover, there have been instances in the last 2 years that highlight some of the shortcomings of this approach, with students asked to defend slavery or make tweets publicly posted as if they were slavers, and oh so much more. This has created a hostile environment for students to learn in. However, I do not blame the teachers. I blame the school board for not doing whatever it can to ensure that there are consistent resources for our teachers. This is why we are now asking the board to leverage existing partnerships, such as the one with the NAACP, or to found new ones with community organizations, charity groups, and local businesses to ensure that there is a robust supplemental library available for all students and educators across the entire district, be they digital resources or physical books in the hands of educators and on library shelves. Moreover, we require that the supplemental material be representational of the breadth of experience in the lives of our students, so that they can see themselves reflected in their curriculum and thus are better able to see positive educational outcomes. With utmost diligence, we should ensure that the materials and fiction from art from Black, Hispanic, Indigenous, and disabled authors, varying by gender. Thank you. I also have included written copies of the full remarks for everyone.
Okay.
And I have a formal request proposal for Dr. Houlihan to put these items on the agenda with all associated materials
Dr.
included.
Or Jerry McCraw can help take care of that. Thank you.
I
Our next
appreciate it.
speaker is Melissa Filanowitz.
First of all, happy Diwali to the Hindu members of our community. It's unfortunate that tonight's meeting is held on one of the most important holidays of the Hindu faith. Of course, September's meeting was held on Rosh Hashanah, one of Judaism's most important holidays. And while we obviously won't be sitting in this room on December 25th, in the name of empathy, consider how you'd feel if UCPS scheduled anything on Christmas. Empathy is an important skill for us to practice. I know there's currently an anti-CRT witch hunt going on. Of course, we know that CRT isn't taught in the K-12 classroom. So what folks are actually afraid of is diversity, equity, inclusion, and social emotional learning. None of these are bad words. None of these concepts is scary or evil or intended to make kids feel guilty or divided. In fact, the Citizens Action Committee recommended a focus on both DEI and SEL. Educators, trained experts will tell you that kids need to be empathetic. They need to feel included and seen. They deserve an equitable and purposefully diverse education. Whether on the topic of DEI, SEL, or COVID, it's been unsettling to see experts being ignored and disrespected. Just as the medical professionals serving our community should be the guiding influence in COVID-related decisions, the teachers in our kids' classrooms should be respected and listened to on matters of curriculum and best practice. Micromanaging only undermines and disrespects them. Policies like the recently revised Employee Code of Ethics 3-2A are solutions in want of a problem, and they make it seem like our teachers are behaving unprofessionally. Teachers are busy, tired, and working hard for our kids every day. They aren't part of some devious plan to indoctrinate kids and destroy the fabric of society. But if they continue to be treated like they are, we're going to be the ones who lose. In the absence of true empathy and understanding, it's important to seek these things. The comments from teachers read at the last board meeting seem to pique the interest of those present. I would encourage you not to dismiss their concerns, but to actually seek out their voices in a more robust way than just stating that you have an open door policy. A survey from last winter does not reflect the current climate. And if teachers say they feel uncomfortable speaking up, then they feel uncomfortable speaking up. I want you to ask yourselves what you can do to make the backbone of UCPS, our teachers, feel like their voices are heard, their concerns are addressed, and they're actually valued. Thank you.
Tricia Reyna.
I'd like to take this opportunity to say thank you to the board for continuing to keep the children of Union County mask optional. I want you to know that my family appreciates you and is forever grateful. I've seen a dramatic change in my children's mental health this year. It's been far too long since my children have seemed happy, and this year they are truly happy. So thank you for fighting for my children. It was said in the meeting 2 months ago that children are only in the care of the schools a third of the time, and the other 2/3 they are out in the community. Since then, we have been paying attention to how these pro-mask parents and their children live their lives in our community. Some of the same parents who are outside today with a mask strapped to their faces are the same parents who were in crowds of people at Halloween events last weekend without masks. One business owner who wants masks on kids was serving food from her business at a Halloween event without a mask. We've seen these parents at indoor sporting events with thousands of kids, no masks. My personal favorite, though, are the parents we've seen smoking cigarettes in their cars and then fighting to mask up the children. I guess these magical masks also protect their children from the dangers of secondhand smoke. Since they have decided that they know what's best for our children, our community sees them and also sees the hypocrisy. We are tired of them telling us that they know what's best for our children while selectively choosing where a mask fits into their lives. In fact, they instructed people to come here tonight with masks so the media knows which side they are on, not because it will keep them safe. This is all for show. I believe the phrase is political theater. Because the truth is, if they absolutely believe that their children and families were in danger, would they really be sending their kids to school? As a parent, I know I would not send my children anywhere that I thought they'd be unsafe. And I certainly wouldn't entertain the idea that a piece of cloth is the magic shield keeping everyone safe. The weekly numbers speak louder than any parent here tonight, with less than 1% of UCPS students being positive on any given week. However, we have approximately 4% of our healthy kids in quarantine every single week without any adequate educational programs in place. It's obvious that Roy Cooper and Mandy Cohen are going to continue to use our children as political pawns by making contact tracing and quarantine a long-term thing without any regards to their rights, while also continuing to let this board take the blame. I know they have tied your hands with options, so I'm asking the board to consider an appointed task force of parents who would be willing to find creative, appropriate solutions and re-examine budgets. We cannot keep failing these healthy quarantine kids because of Cooper and Cohen's political agendas. Thank you.
Maria Palisios.
For weeks now, parents have emailed and stood before you pleading for you to listen to the experts and vote to require masks within our schools. At times, you've replied with, "What experts?" So I am here to hopefully provide some clarity on which experts it is that these parents have asked you to listen to and why it's important that we listen to them. First of all, by experts, we mean the people with science and medical degrees who are trained to use proper methods to collect, analyze, and interpret information. Yes, there are proper and best ways to do that, and no, a person without training in science cannot easily do it. For the purpose of elaborating on this point, I will use two specific examples in which you have either misinterpreted or incorrectly analyzed data. I will also briefly explain from a science perspective what is wrong with your interpretations. Example number one. In your statement published to the UCPS website on September 15th, you provided a link to nc-covid.org, which you said shows that, quote, "The rate of transmission in our schools was lower than many other districts that have a mandated face covering requirement," end quote. However, you severely misinterpreted the information provided on that site. nc-covid.org does not show rates of transmission for schools. It shows the case rates, but not for schools, for the entire population of the school district. I can't speak as to what led to your misinterpretation, but what I can say is that any scientist can look at that site and not only understand what it contains, but they can also discuss the value of providing that type of information broken down by school district rather than by counties. On to example number two. Earlier this school year and at the September 20th Board of County Commissioners meeting, Ms. Merrill shared information comparing the COVID-19 case rates of the first week of school for UCPS, Cabarrus, Gaston, CMS, and Rowan Salisbury schools. Regardless of whether the information she collected and presented was correct, let me point out what is wrong with her conclusions. Scientists don't draw conclusions from one set of data points. To draw conclusions, we must collect and analyze several sets of data. The more, the better and more reliable our conclusions will be. A quick analysis of case rates for subsequent weeks for the districts that Ms. Merrill compared does in fact show that UCPS overall had higher case rates than those mask-required districts. My point in all this, the collection, analysis, and interpretation of data is methodical and complex, and you have shown that not just anyone can do it properly. Mr. Benson, I hope that it is now clear why parents have been asking you to listen to the experts. They are the ones who have the training, knowledge, and experience to accurately gather and analyze the information you all have been so eager to analyze. Following this meeting, please look for an email in which I will send you brief information on the case rates among the schools Ms. Merrill compared. I would be happy to point out factors that must be considered, as well as discuss continues to analyze case rates for several schools.
Thank you. April Weich.
In Rethinking Columbus Towards a True People's History, teacher Bill Bigelow describes what it's like to have history erased and what we lose when we don't learn and study the facts, essentially what it means to whitewash history. For years, I opened my 11th grade U.S. history classes by asking students, what's the name of the guy that discovered America? A few students might object to the word discover, but they all knew the fellow I was talking about. Christopher Columbus, several called out in unison. Right. So who did he find when he came here? I asked. Usually a few students would say Indians, but I asked them to be specific. Which nationality? What are their names? Silence. In more than 30 years of teaching U.S. history and guest teaching in others' classes, I've never had a single student say, Tainos. So I asked them to think about that fact. How do we explain that? We all know the name of the man who came here from Europe, but none of us knows the name of the people who were here first. And there were hundreds of thousands, if not millions of them. Why haven't you heard of them? This ignorance is an artifact of historical silencing, rendering invisible the lives and stories of entire people. That's what it means to whitewash history. I heard the chairperson say in a previous board meeting that she didn't know students were experiencing racism in Union County Public Schools until she saw anonymous posts on Instagram. So I thought that this board and the community who came out to support optional masking and oppose diversity, equity, inclusion might like to take a simple privilege test to see if you've ever benefited from privilege and might need to decenter yourself in these conversations. Part 1 is about your race. Let's go. Put a finger down if your race has ever been targeted by a system and murdered at a rate 3 times higher than other races. Put a finger down if you've ever been profiled in books, theater, or other arts for centuries as a criminal. If you've ever had laws created specifically to limit your access and opportunity, i.e. to hold you down. Been driven into systemic poverty due to those laws. Been an overwhelming victim of a biased court system. Been incarcerated en masse in for-profit private prison systems for money. Part 2 is about you specifically. Put a finger down if you personally have ever been denied a loan, a job based solely on your name or skin color. Have you ever been viewed as a threat just because of your skin color? Have you ever had to justify your presence in a bank, neighborhood, or coffee shop just because of your skin color? Black Lives Matter co-founder Janiyah Khan explains, privilege is not about what you've gone through, it's about what you haven't had to go through. Thank you.
Brittany Bolden, speaking for Moms for Liberty, you will receive 5 minutes.
Thank you. Thank you all so much for allowing me the opportunity tonight to speak to you. My name is Brittany Bolden. I'm here on behalf of Moms for Liberty. We are about one thing, parental rights. We are parents who believe that we decide what goes on and in our children's bodies and minds. First of all, I want to take a moment to thank this board for standing up for our parental rights. Can y'all hear me? For standing up for our parental rights. And I want to acknowledge that I know that you are not responsible for the fact that we have a nightmare quarantine situation, and that lies straight on the back of Roy Cooper. I also want to acknowledge that you are not responsible for the fact that children who are in quarantine don't have an alternative that's virtual. That also is flat on Roy Cooper's back. Roy Cooper and Mandy Cohen are making y'all's job way more difficult than it needs to be, and I recognize that. I'm here tonight to talk about Panorama. I dropped my speech, so my phone just died. I'm here to talk about Panorama. This is something that all parents should be concerned about. Panorama is currently in our schools, so parents, please listen to what I'm about to share. Panorama should sound familiar to everyone because 2 weeks ago, all parents received an email to inform us of an upcoming survey that would go to all students from grades 3 through 12. This upcoming survey is the third in a series of 4 surveys distributed to students and began this week. So what is Panorama? Why are they surveying our children? And why should we be concerned? Well, Panorama is a third-party education vendor that sells a survey-based program to school systems for a very lucrative amount of money. Then they take that data and create programs, teacher workshops, etc., all based on our child's feelings. They can take the data on your child and sell it to the government like DPI and DHHS, again, for big bucks. Then the Department of Education, along with the Department of Health and Human Services, moves towards putting mental health programs inside of our schools and mental health positions within the school's administration for big time salaries. In other words, your child's feelings captured on a survey are the widgets that these big third-party education vendors sell. It is a money-making scam and a government spying program that is being pushed by the Department of Education and special interest groups. Here are the specifics for UCPS. In October 2019, our Board of Education was approached by the administration staff here to hire Panorama. We're told that it was a part of their strategic plan. They entered into a contract for the term of October the 1st, 2019 through June the 30th, 2022 at a cost of $76,725 to distribute 4 surveys, give analysis of those surveys, and make recommendations for programs and intervention. This is all wrapped in a movement called SEL, Social and Emotional Learning. We also have an SEL coordinator in the administration here at UCPS, and her salary is $78,768. Her job is centered around surveying our children. Now let's pause for a second and ask some more important questions. Are our schools mental health providers? Are they medical facilities? Have we as parents asked for this? The answer is no. Most of us send our children to school to learn, not to be under the microscope of progressive initiatives. But is there more to it than just making money? Absolutely. The end game is to fundamentally change school as we know it. With every initiative, it's less and less about learning and more about progressive programs, focusing on equal outcomes and groupthink. But ask yourself, who is pushing this? Well, our DPI and State Board of Ed have huge roles in this. They have big-time lobbyists in Raleigh who are whining and dining to get these highly lucrative programs into our schools. It has nothing to do with children, and it has everything to do with money. Here's what you must ask yourself. Is our school a place of education, or is it a mental health facility? Should children as young as 3rd grade be filling out surveys about how they feel on any one particular day that will then result in money spent on programs? What about middle school students going through puberty and a whirlwind of emotions they experience from hour to hour? Should they be surveyed on how they feel, which could literally change minute to minute, that will then result in the creation of intervention programs? What about high school students who might be emotional from breaking up with a boyfriend or girlfriend? Should they be surveyed on their feelings, which could also change minute to minute, that would result in the school creating professional development programs for our teachers? Keep in mind, our brain's frontal lobe isn't developed until 25 years of age. Yet we want to survey these children between 8 and 18 and use their emotions to create programs in education.
Thank you very much. Sandra Green.
Good evening. First, I'd like to point out I'm not speaking on this topic, but I find it very interesting that everyone that's here for mask, that's pro-mask, has taken off their mask every time to speak on this podium, put it here where it's contaminated, not been cleaned, but you want my child to wear one all day long where they're learning to enunciate and read, but that's okay. That's besides the point. My child is in UCPS. A couple months ago, I came here and I spoke on the extreme dangers of critical race theory. What it promotes, and I urge this board to ban all forms of it. Yet, I'm back here today because it's clear that one way or another, it's sneaking in its way back into our school systems. We see critical race theory has now been rebranded as social and emotional learning and is being pushed on us at the state level by the lovely Catherine Truitt, who has proved herself as a major supporter of SEL once elected. So by changing the terms used, this is how promoters of CRT evoke sympathy for their views without changing their argument. This is now another vehicle for anti-white racism in our schools. SEL is promoted by such vendors as Panorama, which Brittany just mentioned, which is the one UCPS uses. Another one is Castle, which is the main vendor, which calls for the focus to be less on academic content and knowledge in schools and more on our students' attributes, values, and behaviors, telling us, the parents, that these products are transformational tools that will stimulate greater academic achievement and personal fulfillment for students, unquote. This is not only a huge risk to our students' psychological development, but it violates their privacy by collecting personal data, which many times without parental consent, and looks to mold our children into the type of human being the government deems them most useful for economy and society and state. As I've said on this platform before, my job is to teach my child emotions, values, moral, and empathy. The school's job is to teach academic skills, math, English, science, history. With that said, I've heard many on the opposing side stand here and say that we don't want to teach all history. That is on the contrary. I want my child to learn everything about slavery. Why? And discrimination. Because why? I don't want this to continue. Erasing history, changing history, removing textbooks, statutes, all it's doing is indoctrinating and manipulating, and it's propaganda. I'm from Argentina. Teaching my child that she is a white supremacist, a problem in society because of her skin color, is like telling my husband, who's of English descent, that he's responsible for the invasion of the Falkland Islands. That's asinine. I'm not a white supremacist. I'm not a domestic terrorist, as some in government have deemed me to be. I'm a proud first-generation American citizen, and I refuse to have my child, myself, be divided by skin color, ethnicity, or gender. Thank you.
Noyes Harrigan. This will be our last speaker. Thank you.
Hi, my name is Noyes Harrigan. I'm the parent of a Sun Valley middle schooler. Thank you for the opportunity to speak tonight. In this month of Thanksgiving, on behalf of my family, I'm truly thankful for our board for standing up for the rights of families to make their own medical decisions. Thanks for the courage of members of this board who returned to school as soon as possible, even though it took neighboring counties almost another school year to do so. Positive so-called cases continue to drop despite the lack of a mask mandate. And more importantly, my son loves his first year in middle school. In the story of the Trojan War, the battle-hardened warriors of Troy did two strange things. They accepted a gift from a known enemy, and they failed to inspect the gift before rolling it through their gates. Had they inspected the wooden surface of the horse, they might have noticed some hinges, the outline of a hatch, or perhaps some scuff marks left when the Greek soldiers climbed in. Instead, they unwittingly brought something into their city, which was their downfall. Social and Emotional Learning, or SEL, is a Trojan horse which is being used by the State Department of Public Instruction to introduce leftist political activism into our children's education. Even a cursory glance at SEL material reveals the hinges. What is it? Well, it's according to the website from the NCDPI, it's the process through which all young people develop healthy identities, manage emotions, achieve personal and collective goals, and feel and show empathy for others. That doesn't sound too bad, but let's not roll it in through the gates yet. What identity? Empathy for whom? These things are personal and should be directed by a student's family, church, and community groups, not by state bureaucrats. But perhaps we're looking a gift horse in the mouth. Reading further, the state website links to a survey on SEL and equity, where it asks the responder if their district uses SEL to help students examine their racial and gender identities, appreciate diversity, and co-create inclusive environments. Well, that escalated quickly. In less than 30 seconds, we can find the hinges, the door, and the scuff marks on the horse. SEL is revealed to be a vehicle in which a school can help your son or daughter examine their gender identity. The terms diversity, inclusion, and equity are progressive shorthand for conformity, censorship, and discrimination. Instead of improving reading, writing, math, our state DPI is focused on making students and teachers into leftist cultural critics, sociologists, and activists. To recap, the state is presenting us with a gift of improving kids' social and emotional skills while smuggling critical race theory and a progressive political agenda into our schools. In response to this, I've heard some say that UCPS may be using SEL, but not the CRT part. For that, I am thankful. But SEL standards are in all grades. Union County employs a full-time coordinator of SEL, and we have over 50 schools. The incentives and expectations are there for it to develop into what it is intended to be. And I ask the board to maintain vigilance with respect to SEL activities in UCPS. Thank you for your time.
Thank you. That concludes public comments for this month. That brings us to approval of open session meeting minutes for October 5th and October 12th.
So moved.
All those in favor say aye.
Aye.
And that brings us to the consent agenda.
So moved.
All those in favor say aye.
Aye.
Aye. And I will turn it over for the superintendent's report.
Thank you, Madam Chair. Good evening, board members. It has been quite the busy week and month. So I have several items to go through with you. First of all, we are very excited to announce again that our community-based volunteer program, Read With You, is back. If you're not familiar with Read With You, this is our literacy initiative that connects elementary students to community members to continue fostering a love of reading. If you have 30 minutes in your weekly schedule to sign up and volunteer, this year we will have options for you to mentor and read either in person or virtually. A formal announcement will be made tomorrow by the district, and we will launch our webpage that will include information on how you can sign up and you can see which schools are participating. So please stay tuned to our social media handles and our website because more information is coming out tomorrow. And we look forward to this getting back in gear. We're also a few weeks away from the holiday season, and that means that our student-led holiday card contest is in full effect. We've made some changes this year, and we're asking our community for your help. We will be using an online voting tool to allow parents, students, and staff to vote on the top 10 finalists. That will take place November 8th through 11th, and the link will be posted on our website and social media pages. The finalists will be celebrated on November 18th through a special virtual meeting and celebration, and we'll name the winner at that time. And good luck to our students who are participating. We also want to give a big shout out to our school nutrition services department for winning, it's a bit of a tongue twister, a silver state level Turn Up the Beat award. They were named yesterday for the outstanding job they did this past summer serving meals in our community. And just for perspective, this past summer, UCPS served 41,343 breakfast meals, 70,450 lunches, and provided 8,681 snacks. Our school nutrition team was one of 4 in the state to win this recognition. So to Denise Lamar and all of our school nutrition employees, thank you for what you do, and thank you for this great distinction. We also have had a very successful athletic season so far this fall. In girls tennis, Marvin Ridge High School will be playing East Chapel Hill in the finals in the 4A state championship. In boys soccer, congratulations to Weddington, Cata, Monroe, and Forest Hills, who are all playing tonight as we speak. In cross country, congratulations to Weddington, Parkwood, Porter Ridge, Cuthbertson, Marvin, whose boys cross country will all be competing in the state championship this Saturday. In girls cross country, congratulations to Cuthbertson, Weddington, and Marvin Ridge. They will also be in the state championship this Saturday. In football, see, y'all thought I was done, didn't you? But I'm not. In football, Weddington, Marvin, Parkwood, Monroe, Porter Ridge, Forest Hills, and Cuthbertson all have games this Friday night. So we want to say a big congratulations to our student athletes. There was a lot of discussion that when UCPS moved from 3A to 4A, we might be notched down a bit, and that has not happened. And we want to, I say it all the time, bring those rings back. We love them. So good luck to all of you. And last but not least, we have named our 2021-22 Principal and Assistant Principal of the Year. Congratulations to Les Deming of Wolf, and on our Principal of the Year, and Miss Nicole Felix of Wesley Chapel, our Assistant Principal of the Year. We're very proud of these leaders, and I know they'll do a great job representing UCPS in the next year. And finally, 3 weeks from today is Thanksgiving. Happy Thanksgiving to all of you, to our staff, to our wonderful employees, and to our community. Thank you.
Thank you, Dr. Houlihan. That's a good report. That brings us to the IB program expansion, and I will turn it over to Dr. Breedlove.
And as they're walking to the podium, I'll start by saying tonight we are pleased to bring a International Baccalaureate expansion proposal for consideration with the board this evening. The board has been talking pre-COVID about the idea of expanding International Baccalaureate possibly to another school other than the one that we currently have at Marvin Ridge. We have also provided transportation in the past to Marvin Ridge for all students, but we really didn't get much of the return on that with the number of kids who were signing up. So tonight, Dr. Breedlove and Ms. Garner will be sharing a presentation with you. This was presented to the curriculum committee yesterday and received unanimous support. So Dr. Breedlove, I'll turn it over to you. Thank you.
Thank you, Dr. Houlihan. Also, thank you to the curriculum committee board members yesterday for allowing us to present this proposal for IB expansion within Union County. And so with me tonight is Ms. Jessica Garner. She is the Director of College Readiness and oversees, among many things, the IB program in Union County Public Schools. And so I'm going to turn it over to her to take us through the presentation.
Thank you, Dr. Breedlove. Thank you, board members, for the opportunity to share this proposal with you. It's very exciting to just share a little bit about the IB program and what this entails. So just to give you a little bit of background for what the IB program is, it was originally created in 1968 when international diplomats and travelers from multinational corporations said, you know, we live all over the world, but we would like to have a standardized university admissions prep program. And so that's really where the IB program was founded. The mission of the International Baccalaureate is to develop inquiring, knowledgeable, and caring young people who help to create a better and more peaceful world through intercultural understanding and respect. So, you know, that is really their mission, and that was their original vision. The current Union County Public Schools model, the IB diploma program, is what is actually part of the International Baccalaureate organization. But we knew that with students, this was something that we started several years ago. The IB pathway program that we have in 9th and 10th grade is our version of a way to prepare students. So we saw that numbers were smaller when students had to change high schools between 10th and 11th grade. Some of our students who were interested were scrambling to get the courses they needed right before that 11th grade year. So we developed what is called the IB pathway program. This is really just a preparatory pathway for 2 years for students to take honors courses and make sure they have the prerequisites ready to go into the IB diploma program. The IB diploma program is an 11th and 12th grade year program. All of the courses do span 2 years, and the courses are in core subject areas that you can see: English, world language, social studies, math, science. And then there's also something called the IB core that students take. This is one course called the Theory of Knowledge course, where students really learn the 8 ways of knowing, and they learn about how to learn better. There are also 2 additional components that make up the IB core. You have the extended essay and then a creativity activity and service project that students work with mentors on to fulfill those requirements during the 2 years that they're in the IB diploma program. Over time, you can see that our enrollment has increased. In 1920, that was the year that we introduced the IB pathway program. So that was the first year where we had 9th graders along with the 11th and 12th graders. And so you can see in 2020, 2021, even in the middle of COVID, we had our highest enrollment in the IB program that year, with all 4 grades represented. It dipped a little bit last year, but numbers were still strong. We think that a lot of that has to do with students being a little weary of a rigorous program, not knowing what to expect with this school year. As you can see, with our numbers increasing, we have had increased demand over time. But because of the geographical location of Marvin Ridge High School, we really have had limited numbers of students from outside the Marvin Ridge attendance zone who have enrolled in and then completed the IB diploma program. We tried lots of different measures to increase that, and I think ultimately geography got the better of us. So the proposal that is before you tonight, that I believe was already voted on in the consent agenda, was to place a second, it was not, okay. The proposal tonight is to place a second International Baccalaureate diploma program at CADA, which is centrally located and also already has transportation established. Annual enrollment for this would not exceed 50 students. I'm going to share the timeline with you. So we are seeking board approval of this year. The current principal of CATA, Ms. Merritt, would attend training if approved. Then we would submit an application for candidacy. This starts our formal relationship with the International Baccalaureate Organization to say we want to do this. And they would then begin to guide us through the process of becoming a fully authorized school at CATA for the IB program. We would run the lottery in the spring for our current 8th grade students to enter as part of CATA's lottery. And this is the class of 2026. So you can see that next year, those students would start as 9th graders. They would enter the pathway program, which we do not need permission from the IB to operate because that is our prerequisite program. And then we would really start working with that IB consultant to make sure that we have all of the components in place to be fully authorized. The consultant would visit. We would also begin the process of getting our teachers trained in the IB coursework. There's no official certification, but there is training that is involved so that they understand what that looks like. We would aim to have all of our professional development completed by the 23-24 school year, when we would then submit our application for formal authorization. They would visit to do that formal verification visit. And then our goal is that by the summer of 2024, that the IB Academy at CATA would be officially authorized to offer the IB diploma program, so that those students who started in 9th grade would then, as 11th graders, formally enter the IB diploma program at CATA. Funding considerations for this current school year, really what we would be looking at is that candidacy application fee, but it has no local impact on the budget. There are existing monies to cover that. And then for the 22-23 school year, we would be looking at approximately $20,000 that would cover the IB fees, training for teachers and other individuals such as counselors, and then some course materials. This funding would come out of a combination of federal, state, and local money, really with the vast majority of it coming from federal funding. My next couple of slides, I just want to run through some frequently asked questions as we have had conversations around this, and then several of the questions that were asked at the committee meeting yesterday. So how will this fit into CATA's model? Essentially, this will become a separate academy at CATA. It'll function just like the current academies that are there. So the lottery will be the same, et cetera. This question was asked, what type of certification or training is required for the principal, the teachers, the counselors? So this is training that is offered by the IB organization. There are various training opportunities for these different individuals, and it's about a week long. We have teachers and principals going to this training from Marvin Ridge and have done this for years. So that is something that is offered through them. As far as finding teachers to teach in the IB diploma program, one of the things that's great about this is it's really a core content area. So any teacher who's certified to teach in an English, math, science, social studies, or world language can be trained to be an IB teacher. As far as the academic requirements for students to get into the IB Academy at CATA, this is still being finalized, but last year students were required to have a 70 average across all content areas in the 7th grade year and also at the end of 8th grade, and they had to be passing all of their courses at the time of application. As far as marketing is concerned, the question of how will we market this, it will be through the similar channels that we have done for CATA with the CATA Crawl, with social media, things like that, the High School Programs Expo, but we will also put an additional emphasis on making sure that we get the word out through peach jar flyers. We can also have parent information nights and things like that. Question about, can students who are currently enrolled in the IB program at Marvin transfer to CATA to be part of their IB program? That will not be possible because of the way that we're going to roll it out. So if students are currently enrolled in Marvin, they will continue there until they are completed, regardless of what school they are zoned to. But because this program is only going to be available for rising 9th graders, so there won't be anything for the students who are existing at Marvin at CATA. We've already mentioned that 50 students per year will be accepted. How did we decide on 50 students per year? This is very consistent with what we were accepting at Marvin Ridge and what the interest level was at Marvin Ridge High School for students outside of that attendance zone. So we felt that that made sense. We also wanted to make sure that we kept the numbers small enough that it didn't completely overwhelm CATA. It's very consistent. It's on the lower end of the academy size at CATA for what they offered last year for the other academies in those lotteries. And if Marvin Ridge High School students are interested in the IB program, will they have access to the IB Academy at CATA? So this is not something that I'm prepared to discuss right now. Ms. Morris is going to address this in a future policy update in the student assignment policy. If a student doesn't like the IB Academy at CATA, can they switch into another academy? CATA's policy currently says that they have to stay in the academy that they initially choose. And so that is consistent with what that would look like. I believe there is an opportunity for 10th graders to apply to CATA if they didn't get in as 9th graders to select if there is space in various academies. So that would be consistent for this program as well. Will CATA's building need an addition to support the program? And the answer to that is initially no. These are courses that don't require specified types of classrooms or equipment or things like that. So when you look at CATA, right now, each teacher pretty much has his or her own classroom where they teach 3 out of 4 classes a day. So that block of time where they're not teaching would allow additional teachers to what we call float into that classroom and teach while that classroom is unoccupied. This is currently happening at all of the rest of our high schools. I think CATA is the only school right now where teachers do not go into other teachers' classrooms during planning periods to teach. So it would be fine. We would not have to initially add any classrooms. And that is the end of my presentation.
Thank you very much. We're excited to see this. We've been talking about this for a number of years, so it's nice to see it come through. So I'll make a motion to approve the IB program expansion plan to CATA.
Second.
Okay, all those in favor? All those in favor say aye. Aye. Okay. Thank you so much for your work on this. Again, because I know we've been talking about this for a long time. So thank you very much. Patience wins the day. Yes, right there. Okay, that brings us to voting district realignment. And I believe, would I turn that over to Michelle Morris or? I think you helped lead us through those meetings.
Yes, ma'am. Good evening, members of the board.
Good evening.
You've had your, the presentation from Ms. Stagner and Mr. Esselstein. I'm going to botch his name. I apologize to Blake, where he presented the maps to you. You then had a public hearing on those. And then tonight before you is a proposed resolution where you will adopt either option A or option B. Both sets of maps were in board docs, and we can pull them up on the screen if you need them for reference. Would that be helpful? Or
yes, please.
Okay. I'll say Preston. Preston, can you pull that up?
So that was the first option, option A, that primarily speaking keeps District 2 in 2 different zones. And then option B, the biggest change you'll see is down at the bottom of the county. District 2 becomes one big area instead of 2 different geographical areas. You can.
Can we make the motion first to decide on the plan and then read the resolution in whole?
And you don't necessarily need to read the resolution whole. It's in board docs. So if you want to approve the resolution with adding which option, the motion could be that to approve the resolution with option A or option B. However you want to go.
Okay. Does anyone want to?
I'm welcome, if you want me to read it out loud, I'm glad to do that as
Okay,
well.
I can make a motion to adopt option B
Second.
and the resolution in board docs.
So
Sorry.
would you like to share the
Sure, I can read it.
resolution?
Whereas the Union County Board of Education is comprised of 9 members, with 6 members elected from districts and 3 elected at large, and whereas the 6 election districts are subject to the constitutional and statutory requirement of 1 person, 1 vote, and whereas the Board of Education has received and reviewed the population of districts as determined by the 2020 federal census, and whereas the Board of Education has determined that the population of the districts is out of balance and that the boundaries of the districts need to be altered to provide equal representation, and whereas the Board of Education is authorized and required by North Carolina General Statutes, Section 115C, 37I, to revise its district boundaries to correct population imbalances shown by a federal census, and whereas on September 28, 2021, the Board of Education reviewed 2 alternate redistricting plans, and whereas on October 21, 2021, the Board of Education held a public hearing to receive public comment on the proposed redistricting plans, and whereas the redistricting plan labeled option B satisfies the requirements of 1 person, 1 vote, now therefore be it resolved by the Union County Board of Education as follows. The boundaries of the 6 districts for election of the Union County Board of Education are altered to follow the lines depicted on the attached map entitled Option B. And I've attached the map to the resolution for you all. The attached map has been prepared using United States Census Bureau data, and the district boundaries have been drawn to follow census block lines. A list of the census geography in each district will be attached for reference and to resolve any issue that might arise concerning the boundaries of the districts. The new district boundaries shall be effective upon adoption of this resolution and shall be used for the next election of board members and for each subsequent election until the boundaries are altered according to law. A copy of this resolution and the map showing the district boundaries shall be retained in the office of the superintendent. Maps and information about new district boundaries shall be provided to the Union County Board of Elections with the request that the board notify residents of the Union County Administrative School Unit of changes in the district in which they vote. Adopted this the 4th of November, 2021.
Thank you, Mrs. Morris. Are there any comments or questions? We have a motion and a second. All those in favor of the motion say aye.
Aye.
Aye. All those opposed? 1, 2. So the motion passes 7-2 for map B. Matt Helms. So 7-2. Thank you very much. So Mrs. Morris, will you notify the Board of Elections, or what's the next step of this vote?
Yeah, after you sign this tonight, tomorrow I will forward this to the Board of Elections.
Thank you. Thank you very much. That brings us to the COVID-19 update. I'll turn it over to Mr. Jared McCraw.
Thank you, Ms. Merrill. Thank you, members of the board. Good evening. This evening, I wanted to provide a COVID update for Union County and Union County Public Schools. I continue to say the goal of UCPS throughout this pandemic has been to keep students and staff in our buildings and to make them healthy and safe, and that's our number one priority. We have done that throughout this pandemic. I tell you that each month that I give you that report. COVID numbers, and this is good news, they continue to move in the right direction. According to Mr. Joyner, talking with the state, they're seeing sustained decreases in a lot of areas. UCPS staff continues to meet with Mr. Joyner and public health staff 2 times per week, and I talk to him pretty well daily as well. Our staff that meets with him, myself and our lead nurses, we meet with him. We discuss what's going on in Union County schools as well as Union County and across the state of North Carolina. Here are a few of the numbers that I give you each month. The current positivity rate as of this morning was 6.3%. I received that update from the county around 10, 11 o'clock in the morning, so sometimes there can be changes throughout the day, but it was 6.3% positivity this morning. How does that compare to last month at this time? October 5th, the positivity rate was 11.2%. So a big decrease in that positivity rate. Now, as it gets closer to a smaller number, we are seeing less decreases, but it's staying around 6.3, 6.2%. Today, the 7-day average as of this morning for cases per day, new cases, was 41.7 cases per day.
Before we go on to the positivity rate, so the one that the state does, the 6.3 is a 14-day average, right?
It is, yeah, that is
But on the
correct, Ms. Heinkel.
CDC, they have the 7-day one, and it's like 5.3 or something like that.
That is correct. And,
So-
and I use the North Carolina
I know.
rate.
I-
Yes,
yeah.
ma'am, Ms. Heintel. So you are correct, though. So the 7-day average back on October 5th was 94.3 cases per day. So today it was 41.7 new cases per day. 1 month ago on October 5th, it was 94.3 cases per day. So the data from the UCPS COVID dashboard from October 25th to October 29th, we had 81 positive cases for students and staff across our 53 schools and central services. This resulted in 1,601 students and staff being either isolated or excluded. The number of positive cases keep declining. We've seen sustainability over the last few months there, or last few weeks. And then also the number of students being isolated or excluded, they are decreasing at this time as well. Hospitalizations at Atrium Union, we get that report Monday through Friday each day. They are decreasing with the number of COVID-related cases in the hospital. We hope that trend continues as well. This is my COVID update for this evening. Do you all have any questions?
I have some questions, Jared. We all want the kids, healthy kids in the building. And as we are painfully aware, there are several options that a student would not have to quarantine. Basically, they've been vaccinated or they've worn a mask. And the third option is if they have tested positive in the past 3 months and do not show symptoms. My question is, so first of all, first scenario, the student had tested positive 3 months and a day ago. They do not qualify for the exception for quarantine, and they would be subject to quarantine, correct?
That would be correct by the way the exclusionary protocol is written.
All right. Here's the number 2 scenario. Unbeknownst to the parents or the child had COVID. It was asymptomatic. No symptoms at all. But because the parents can't trace the date when the student was positive, didn't even know he was positive, and now he's developed antibodies because he did have it, was just asymptomatic, he does not qualify under these requirements to be exempt from quarantine because he can't trace the date back. Didn't even know he had it. Is that correct?
That is correct.
There is a fourth option listed right on page 16 of the toolkit, and I'm going to read parts of it, not the whole thing. An additional potential exception to quarantine are persons who are not fully vaccinated and have tested antibody positive within 3 months before or immediately following a close contact may not need to quarantine if they've been limited or no contact with persons at high risk. Exemptions from quarantine based on a recent positive antibody test can be considered on a case-by-case basis if approved by the local Public Health Department. To your knowledge, have any UCPS parents asked for this exemption for quarantine and provided proof of a positive antibody test?
I know I've had parents request that we take antibody tests. As far as them showing proof, I don't know because it would go through the public health director, but I
Okay.
do know parents have requested that, Mr. Sides, that
Oh, and you really wouldn't have any way of knowing that, but be between them and the health department. So if I get, my son brings home or I'm notified of a letter, he's to quarantine because of close contact. And I take him to our family doctor and they do an antibody test. Next day, same day. I should be able to take those test results to the health department, to the appropriate persons, for them to consider an exemption from quarantine. As I'm reading this in the toolkit, is that correct?
Yeah, if the local health director does review antibody tests on a case-by-case basis, that would be an additional exception. Our public health director in Union County at this time has not accepted the antibody tests. It would take people power, it would take staffing to review those. So that's the
Okay.
reason. I know we have discussed it.
Well, I
with
see
him.
you see where I'm going.
Yes,
And you are not Mr. Joyner, so I don't want to press you too hard. And since Mr. Joyner hasn't chosen to accept our invitations to come speak with us in person, I'm going to have to do it through you or through more formal channels. I want to know why he doesn't. Because I can promise you, if my son gets another one of those letters, I'm going to do that exact thing. And if he tests antibody positive, because both myself and his mother have tested positive earlier this year, if he tests positive for antibodies, I will be going down to visit Mr. Joyner and bring those test results, and he will have to give me a reason why not. Because the whole idea is you have antibodies, right? I mean, either you're getting it, and some may say it's not antibodies, but you're getting a vaccination or the vax or the chemical shot into you, whatever you want to call it, whatever you believe, to artificially induce your body to accept, to fight off, or you've already had it, which they accept if it's within 90 days, they'll take that. So what I'm saying is, who made up the magic number of 3 months?
90 days.
It's 3 months in a day, 6 months, 9 months, a year. The whole key is you've got antibodies. So I frankly, I'm just saying, I'm not going to tell anybody what to do. You're going to have to do it yourself. You're the parent. That's what this all is about. Parents deciding what's best for their child. But as a parent, if my son is given notice of quarantine, I will be taking him to his doctor for an antibody test. And if he tests positive for antibodies, I will be going to the health department and they will have to tell me why they won't accept it. And if anybody else feels the need to go that route, like I said, that's your deal. I'm just saying what I'm going to do because this makes no sense when the whole idea is you have antibodies. Okay?
So I'm not sure. I agree with you, Mr. Sides, and the ability to have an antibody. I mean, it's right in the toolkit. So please correct me, Mrs. Morris, if I'm wrong, but I'm under the understanding that schools can follow what's in the toolkit. And so I don't know if you can answer for Mr. Joyner on why a student or a parent couldn't show our school nurse their antibody test to come back to school. It seems pretty simple to me that they just provide the school, their antibody or their vaccination status or whatever, and just come back to school. So I don't know if you know why Mr. Joyner will not accept antibodies, which is offered in the toolkit.
Well, I'd like to go a step further. I'd like to again extend the formal offer for Mr. Joyner to appear before us, and I don't care if we have to call a special meeting to do it, and tell me in person, answer the question, why you won't accept a positive antibody test when it is plainly right here in the toolkit, which is the Bible as far as quarantining goes. Or I suggest or staff write a formal letter, either from Ms. Morris or signed by Ms. Merrill, to Mr. Joyner requesting to recognition of this option, and if not, why?
I think what we'll do is we'll put together a formal request if that's the pleasure of the board. But the other confusion that, is do we follow the toolkit or do we not follow the toolkit? And antibodies is in the toolkit. So I'm not clear on why we can't accept that, because I also know with presumptive cases, if they show proof that they had allergies or strep or a tummy virus or some other thing, they're allowed to come back to school with the doctor's note, correct? With an alternate diagnosis. So why can't they do the exact same thing with their family doctor instead of doing the alternate diagnosis to return to school with antibodies?
I'll take it even a step further. How's it fair to UCPS parents to recognize some of the options in the toolkit and not all? Why does he not agree with this? Has he not been asked? Has nobody brought him a test and said, okay, given him the opportunity to agree to it? Or has he denied anyone that's come forward? And why? That's what I'd really like to know from him. Why are we either not abiding by this option, or why have you not been asked?
Yeah, I think it's all been Mr. Side's capacity related issues, where if he got lots of antibody tests, the staff it would take to review all these tests on a case by case basis, it would just take too much time. That's what it was initially.
Well, I guess that would depend on how many tests you get, right?
Correct. Early on in this, he was going to get so many, he couldn't review all those on a case-by-case basis. We are at a different point. You heard what I said tonight. Lots positivity rates down, numbers of cases are down. I know you're going to do it formally, but I will be glad to discuss it with him, email him to get a response. But you did say you were going to do it formally. But we have discussed antibody tests. It was just about staffing, about the number of cases that would be brought to him, and he would have to review those on a case-by-case basis. He just didn't have the capacity.
Hold on. I want to hit this capacity issue. How long have we been in this pandemic? And how much COVID money has the county received? Now, if they are short-staffed in public health, still, after we've been at this pandemic for what, a year and a half, 2 years? What's the deal? What I've been heard, what, $30-40 million is the county's receiving in COVID money? Maybe you might want to hire somebody in the health department to be able to handle the capacity, since we are have this COVID issue. I don't know. You would think.
Does Mr. Joyner just need to
accept
that as an option, and then the student can bring that to the attendance officer?
No, it has
the COVID,
to. The toolkit says that the antibody test is on a case by case basis with the health director, so he has to approve it, is what I understand.
Yes, that's what it says.
I don't want to put
approved by
Mr.
the health
McCraw in the middle of this, but if we want to do this as a board and ask for that in a written letter, I think that's a fine idea to ask. What we're looking for, and if there's the option to be able to do this, I agree. So
I would like to offer two options.
Okay.
That at Mr. Joyner's pleasure, if necessary, if possible, we will call a special meeting and he can come down here and tell us in person. Also, I would like it in written. I don't want Jared to have to be the messenger for a conversation. I want it in writing. if he's not going to come down here and tell me to my face? At the pleasure of the chair, would this require a motion? I'm sorry? I make a motion that we put a written request as well as an invitation for an in-person visit from Mr. Joyner regarding the issue of antibody testing as an acceptable form of being exempt from quarantine as per the toolkit. And I'll let staff the proper means and wording of the document to be transmitted directly to Mr. Joyner and the appropriate county staff. I'll offer that motion.
Okay, all those in favor say aye. 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 All those opposed? Okay, it's unanimous. We'll put something in writing and send to Mr. Joyner.
Madam Chair.
I have been getting a lot of questions about this new letter that that Mr. Joyner has given us, and I know the schools, we all work with Mr. Joyner in drafting this letter and taking a look at it and making recommendations. So I've been getting a lot of concerns, questions about the language in the letter, and help me since I don't have a letter in front of me. But I believe it's something along the lines that it is recommended that they be out for 14 days, and then then our nurses go in and put in what the 10-day would be and what the 7-day would be.
It actually, when you put the date in for exposure, it calculates the 14, 10, and 7-day
Who's
option.
putting that date in, Mr. Joyner or our nurses?
Our nurses put that date in.
Okay.
So
The
that
date-
means that the nurses then know when the kids can come back based on the 7, 10, or 14 days.
That is correct, Ms. Heintel.
Okay.
And this letter addresses specifically is titled a guidance. It is not a legally binding order of quarantine. Correct?
It is not a quarantine order. It is a quarantine letter. We're following the October 5th legal authority in schools guidance, which required us to exclude students once they're known as close contacts. And that letter met that expectation. We talked to Mr. Joyner. That letter, the quarantine letter, was given to tell students when they need to quarantine.
But legally, this letter is given out. It is not a legally binding letter of quarantine, but we recognize it as similar weight. In other words, if I got this letter and I said, the heck with it, my boy's going back to school tomorrow, and he shows up, whatever means we have it in our system, it's going to be recognized by us, and he
Right.
will not be admitted to
That
the school.
October 5th document that the state put out, that the state health department put out, says that we have to abide by all of the control measures in that the health department comes up with, and that we have to exclude children who have a positive case,
Yep.
symptomatic, or exposed.
I think the emails that a lot of the parents talking about concerning this letter really comes at the end, that last paragraph, when it talks about that this is guidance. However, if you don't follow this guidance, we can come with, legally at you. That's been the crux of the issue, more so than anything else, of that particular letter. Why does that statement have to be in there?
I think what it says, Reverend Bench, is that ultimately, if you don't follow the quarantine letter, a quarantine order could be issued by public health or the health director. I've talked to him about that. He said he's issued a limited number of quarantine orders. If we have somebody that does not abide by that letter, we could talk to him about that. Ms. Morris could talk to their attorney as well. But I'll be honest with you, with the letter, with our nurses, it appears to have worked very well in most situations. It gives you clear guidance. When the exposure occurred, it gives you clear guidance. The 14, 10, or 7-day return to school, the one statement in there does say that ultimately further legal action could be taken up to a quarantine order. It's given on behalf of Mr. Joyner. We would refer people to Mr. Joyner if they had questions at that point.
Yeah, but that is the folks feel like they're being threatened, and so the issue here is why does that even have to be in there? Everything is working well, as you state. Why does that threat have to be in there? And maybe that's something you can talk in your conversations with Mr. Joyner.
Mr. McGraw, you're aware of any quarantine orders given to any of our students or any of our staff?
No, sir, Mr. Price. I'm not aware of any staff or students with UCPS given a quarantine order. I'm not aware of that.
Which goes to the point that most of the citizenry is following the guidance, so therefore the threat doesn't need to be there.
So basically, even though this is not a legally binding document, because of the requirements we've been given from state DHS, whoever, we are treating it as such and not allowing a student to show up to go into, or they go into school, they're going to be in quarantine until the parents come get them. So to me, it's kind of it's not a legal order, but we're being told to treat it as one. You see the contradiction in this?
I understand, Mr. Sides. We're following the We're following the quarantine letter based on the legal authority in schools requirement on October 5th from state DHHS.
I just want parents to understand this, that we're being told to do something as it's being given, just as if it's being given the weight of law, and it's not. But we have to abide by it because of what we're told to do.
Madam Chair,
Yes.
if I may, Mr. McCraw, a couple of questions, not trying to prolong the meeting. The buses, students are required to wear masks on the buses, correct?
Yes, sir. That is a federal mandate requiring students to wear face coverings on buses, public transportation,
Right.
all that kind of stuff.
And if students do not wear a mask on the bus, what happens to that student?
If a student does not wear a mask, we have not been disciplining students. We would ask them to wear it, ask them to comply, make sure that they're aware of the federal mandate. We would continue doing that. We would make parents aware. But as far as an OSS, putting them out of school, taking them off the bus, we have not disciplined students for not wearing a mask. We ask for compliance. We encourage it. And
you have masks available on the buses.
We do.
Yeah.
We do. We have plenty of masks still available.
My son is notorious for forgetting his, so
Okay.
they have a good supply, at least I know.
So, I mean, having them and doing it is two different things. So my second question is, we see that the numbers are going down, and that is a great thing. And I think from August to October, I think my numbers may be right, we had about 2,959 students that may have been Union countywide who were tested positive. Those are reported cases, and all of the cases that we receive are reported cases. And we know that every case is not reported, all right? As well as those children who are home, which is, what was the number today? I think you sent it to us. The quarantine number.
600. You talking about the total number of
Yes.
students? 642 as of today. And
That are in quarantine.
that would be isolated for a positive case, symptoms, or a close contact, or some other COVID-related reason. There were 32 staff members as well.
Okay. All right. So over 600 that are in quarantine.
Correct.
All right. So when the student comes back, I know there's something in, I think, the toolkit that when they come back, they're supposed to wear a mask. They're not supposed to, but suggested.
If they select the 10 or 7 day options to return to school, a mask is required up until the 14-day mark of quarantine.
But they don't have to wear it.
Well, we asked them to wear it. We would, again, I've said.
And I understand the wording should,
Yeah.
required,
Should.
just like on the bus. It's
I said required. It says should wear a face covering up to the 14th day. We ask them to. We encourage it. As far as disciplining, it's the same as the bus. We're not going to give an OSS. We're not going to. We're going to encourage. We're going to make them aware that they should wear it. And if they don't, we have not disciplined students for that.
Okay. So
or staff.
Okay. So I think my concern, which is still the same, that kids can come back, staff can come back, and not wear a mask, which is continuing to keep people in harm's way of COVID. And I know we've had this conversation over and over again for weeks and weeks and weeks, that asymptomatic cases, we know what that means. You don't show any symptoms, but you still have it. So you're not healthy. Okay. And then when kids are home, dealing with that component, kids are home and they're quarantining, they're out of school. And we know that every child does not have supervision. They do not have the support that they need during the school day. I've heard so many concerns and even expressions, even tonight, about how the school has become, it seems like a therapeutic center. All right. But the truth of the matter is we're living in a day and time now where the school is one of the best places for children to be. There are some kids that these 7 hours that they're with these incredible teachers of Union County Public Schools, some of them, this is the safest environment they'll ever have. And so when kids are at home, then they're not learning. Some of them don't eat. And we know that kids need to be in school. So I think it's just, we say that something is required, we're mandated, and they don't do it on the bus. And then we encourage them to come when they come back from quarantine, and we encourage them to wear it, and they still don't have to. So it's one of those things where, because we have some people who are very defiant for whatever reason, all right, we've heard a lot of reasons tonight, and we don't have to get into that. People have their own reasons. Even though numbers are going down, they can be much lower, I believe. And as the holidays are approaching, people are going to be with families and go and visit and travel and what have you. And we know that in the wintertime, colds do increase. You know, it's the wintertime. So I just want us to consider those things and just think about those things. Even though numbers are going down, we want them to go down. Even next month, it's the beginning of the new month. So I'm just encouraging us to really think about making sure that children are in school for whatever reason. Let's kind of just think about it. Just think about it. You know, some options are good and some options are not. And in this pandemic that we are still in, it's very important that we consider and look at how we can help make sure that our students, our families, because an asymptomatic child can go home and affect their family member. One of my classmates just passed away maybe last week. He was dealing with it for 40 days, COVID. And very sad, you know, not looking for sympathy, but just wanting us to think that young people are dying and older people are dying. And even if young people are not dying, they are still being affected. And our children, all of our children, from the east to the west of Union County, they need to be in school. And if putting a mask on them, and as I said before, if we can just consider 30 days and just look at the effect that these 30 days could do for our students and our community, I think we would be very pleased, and we can continue to say that we're doing the right thing. Yes, with our optional choices that we have now, you know, things are decreasing. The option to get the vaccine for our children, that's wonderful, you know. But I think that if we really consider those 30 days and just think about from now until our next board meeting, putting a mask mandate, I think we would be satisfied on what response we would get from the community and our children being safe. So Thank you for answering those questions for me, Mr. McCraw.
You're welcome, Reverend
Jared, I
Kirkpatrick.
had one more question, and I don't know if other is going to have a question too. So one of the questions that I've been getting is about, and I know all of our school nurses fall under your purview in your department and student support. How are our nurses doing? So I guess the number one question that I get is, are we right back where we started? Are our nurses doing contact tracing and issuing quarantines through this letter? How would you respond to that?
I would say no, we're not right back to where we started. Our nurses are in a better spot. Some of it's because the numbers are lower. I mean,
right.
I talked to our supervisors. Listen, we're blessed to have 57 good nurses, 3 good supervisors. I'm telling you, it's in the environment we're in, we are blessed.
So are they doing contact tracing?
They assist with the process. They do give the letter. They give it on behalf of the public health department. But as far as making calls and doing all that stuff, they are no longer making the calls.
So they are not making the phone calls.
They are not.
Okay.
Time thing for them.
It is. You know, when we first started the letter process, we didn't know how that would work, but it actually has worked very well. And I've talked to our supervisors, talked to some of our nurses. I think the letter process has worked well. It helped clear up some of the confusion people had about when did my exposure occur? What's the 14-day? What's the 10? What's the 7-day option? So I think our nurses are in a much better spot. But now a lot of it has to do, we're in a better spot in a community and as a school. Positive cases, quarantines are down, close contacts are down. So symptomatic people are down.
But our nurses are not making phone calls. So that's a huge burden lifted off of their daily work.
That is correct, Ms. Merrill.
Trying to be a school nurse.
Our nurses and our school staff are not making the phone calls, the letter. And, you know, they're always available. If a parent has a question, they can call our nurses. Our
So
nurses are
if a
great.
student chooses to get a test on day 5 so that they can return on day 7 or 8, okay, the next day on day 8, do they have to get Dennis Joyner's approval for that, or do they just simply show up and show the test result to the school nurse?
They just simply show up and show that result to the school nurse or a staff member that they would work with. They do not have to get that approved by the health department.
So the reason I ask for that is if you go to the doctor and get an antibody test, it could be that simple that they show up and they show that antibody test to the school nurse and they're allowed back in. If it's from a doctor's office. Are there any other questions?
Yes. Just curious, your conversation with the health department over the last week about shots for younger students. Do they have shots? Are they ready? Are they giving shots? Where are they at?
They do have shots available for children ages 5 to 11. They actually said they give their first shot today. They wanted me to mention that tonight. If the public wants to schedule a vaccine, they do have those available at Public Health. So they do, Mr. Price.
And what has been said, if they have a shot, do they still get quarantined if they're in close contact?
Well, if you're fully vaccinated, there is an exception. If you're fully vaccinated, which means 14 days post your second shot, then
There's no second shot.
The
Is there
kids have to get a second shot? Oh, okay.
No, what?
There's
I'm
still
sorry.
2 for children?
There-
It is?
There is, I'm asking.
Yeah,
They have
I
to get
think it's 2. They get a half dose, but it would be when they are fully vaccinated. I don't want to, but when they're fully vaccinated, they would be
So
an
just like the
exception.
older kids.
That is correct. Adults and older children, it would be the same way. But they are available at Public Health. He wanted to make sure that I let the public know.
To your knowledge, through the state, and I'll ask Dr. Houlihan or staff as well, as far as you know, can tell, there is no anticipated state mandate for vaccination for children 5 to 11 that you're aware of. Anyone's aware of?
I'm not aware of any mandate that's been talked about or I've heard of.
I just want everybody to hear that. There will be no vaccination mandate for students at UCPS.
I just want to say too that we are following the toolkit, correct? And all the other things that contact tracing that they came out on October 5th. We are following the toolkit.
Yes, we follow.
Except for antibodies. But
We do.
yes, we are following it.
Yeah,
Okay.
when it comes to dealing with presumptive positive cases or positive cases, we are following the toolkit, except for the antibody exception.
Mr. McCraw, I want to go back to the bus driver situation. So if bus drivers are supposed to implement the rules, and when they do, children are not dealt with properly, don't you think that puts them in a bad position as bus drivers when they're doing what they're supposed to do? And if they write up kids, or because these kids know that they can't get in trouble. So how do we help support bus drivers that's trying to do the right thing in this, since really we say it's mandated, but it's really not one?
Yeah, we've not dealt with a tremendous amount of issues from the buses or the selection of the 10 or 7 day option and not wearing a mask up to 14 days. We usually talk to students, they'll comply. If they don't, like I was saying earlier, we would encourage, we would ask students to wear it, make sure they're aware of the mandate. Bus drivers, if they do write the students up, we address it though. I don't want you to think we support our bus drivers. We enforce the rules, but with masks, I think you said it earlier, it's important students are in school, not at home, in the school. But we do encourage them to wear it, to follow the mandate that exists.
Okay.
Madam Chair,
Yes.
I make a motion that Union County Public Schools continue to remain mask optional.
Okay, all those in favor say aye. Aye. All those opposed? 2. So motion passes 7-2. That brings us to policies for first review, review.
Good evening again, members of the board. You have 7 policies and 1 administrative guideline for your review tonight. If you have any questions about those, I'm glad to answer those for you.
Okay.
Okay, thank you.
Thank you, Mrs. Morris. Board comments?
Madam Chair,
Yes.
I want to thank the Navy Junior ROTC programs at both Forest Hills High School and Sun Valley High School for an excellent trip, Dr. Houlihan, last week to my place of marine birth, Paris Island, South Carolina. It was so wonderful to be down there. And Dr. Houlihan, let me say that the commanders and the instructors, the sergeant major and master gunnery sergeant, did an excellent job. But the children had a chance to see up close and personal a Marine drill instructor that I believe they'll be telling their grandchildren about for years. It was real, and they were pretending to be the drill instructor all the way back home. So they had a great time. So I just want to thank both for just a great time.
I would like to congratulate Mr. Deming and Mrs. Felix for Principal of the Year and Assistant Principal of the Year. That was very exciting to see those 2 amazing Union County Public School leaders to be recognized for their work. So just congratulations to them both, and to our outstanding child nutrition and the leadership by Denise Lamar. I just, again, want to say congratulations, because all throughout this pandemic, our child nutrition team has really gone above and beyond for the last year and a half, providing lunches and snacks. I think at one point we were over 1 million meals that have been served during that pandemic. So I don't even know what the number is today. So to Denise Lamar and everyone in child nutrition, I just want to say a huge thank you and congratulations. And we are very, very proud of your service to our county and to our children. And I guess happy Thanksgiving. We're going into the holiday season. So by the time we're here next month, we'll be getting ready for Christmas. So I just want everyone to stay well and stay safe. And those are all of my comments. Anyone else? Okay, board announcements.
Facilities Committee will be November 18th, 9 a.m. at the PDC. Finance Committee, November 23rd, 8 a.m. Zoom.
The Strategic Planning, Information Technology, and Transportation Committee meeting is scheduled for Wednesday, November 24th at 7:30. There's a high probability that we will not have it on that day because it's the day before Thanksgiving.
And the
Dr.
day
Breed-
before my birthday, I may say.
Dr. Breedlove, I want to confirm curriculum, was that going to be on the 18th at 10 a.m. here at the PDC? Does that conclude announcements?
Madam Chair, policy is November 16th, 8 a.m., and it will be Zoom.
Okay, and I'll just remind everyone, because we do have the holidays coming up, if anyone is wanting to make sure, they can always check the calendar on our website to, if things do have to get moved or canceled with the holidays. With that being said, I'll accept a motion to adjourn.
Motion
So
to
moved.
adjourn.
All those in favor say aye.
Aye.
Thank you, everyone.